So as families begin to review their health insurance for next year, many are getting some sticker shock here. There are surveys that show quite a jolt in premiums, especially for the individual plans if you have one through healthcare.gov. Just add it to the list of insurance woes after steep hikes in both home and car insurance lately. Our political editor Craig Patrick explains tonight what's causing it and how much more it could cost.
Last year, Gallup polling found satisfaction with American health care dropped to the lowest level in 24 years. Customers rank the growing cost as the biggest problem by far. And now we're facing the steepest price hikes in at least the past 5 years. There are several reasons for this, starting with inflation.
If the insurance company has to pay more for health care, guess who's ultimately paying for it? You and I are.
Overall, inflation peaked more than 3 years ago, but inflation in the healthcare industry usually lags behind the rest of the economy. And due to health labor shortages and how contracting works, costs are now taking off more in the healthcare industry. At the same time, some medical providers are expanding their power to negotiate higher rates.
Monopolization and consolidation of different provider networks. Large healthcare systems taking over local clinics.
At the same time, we have a national surge in doctors prescribing GLP-1 weight loss drugs like Ozempic.
Half of Americans are eligible for Ozempic-like drugs with obesity and diabetes.
In time, that could reduce obesity-related illnesses and bring down health insurance costs. But for now, those drugs, which can cost around $800 per month or more per patient, are costing health insurers a fortune.
And some of them that are choosing to cover these drugs are setting their premiums at a higher rate than we would otherwise see.
Plus, President Trump has called for new tariffs or import taxes on imported medical devices and prescription drugs. And the United States imports around 30% of prescription drug components from China. Now, those tariffs may be subject to change, but health insurers are assuming they will kick in as proposed, and they're figuring that into their price hikes for 2026. A range of surveys show health insurance plans that people get through their work will go up around 9% on average. And research from KFF shows plans that individuals buy through healthcare.gov will go up around 20% on average.
They are going to face higher prices because of the uncertainty with the Trump administration, with the One Big Beautiful Bill Act and how it's going to affect the marketplaces.
And on top of that, some of the tax credits for people who buy those individual plans will expire at the end of this year. Congress could but likely will not renew those subsidies. And the KFF study shows that could also drive up costs for consumers who buy those plans by 75%.
That translates to spending $1,300 more a year for premiums alone.
Or more for health insurance at the same time that general inflation has ticked up the past few months. And here in Florida, people already rank the cost of housing and the cost of property insurance as their top two concerns. Craig Patrick, Fox 13 News.